Hello. Let's talk about osteoporosis in a responsible way. What we know for sure, what is promising, and what is still unproven. If you're over 60, the fear of falling is not irrational. Hip fractures can be life-changing, and in many countries, first-year mortality after a hip fracture is roughly in the 20% range. So yes, this is serious, but fear is not a treatment plan. Your bones are living tissue. Every day, bone is being broken down and rebuilt. Osteoporosis happens when, over time, breakdown exceeds rebuilding and the structure becomes fragile. Now, you may have heard dramatic claims online about a single hormone that reverses osteoporosis. Today I'm going to explain one of the most discussed research molecules, Irisin, and then I'll give you a safe, evidence-calibrated plan you can discuss with your clinician. Irisin was first described in 2012 as a messenger released from muscle, especially in response to exercise, and it is also studied in cold response physiology. Researchers are interested because muscles and bones communicate. When muscle is active, bone often benefits too. But here's the key point. Irisin is not an approved osteoporosis treatment target. It is a research marker and mechanism, not a proven therapy. What do human studies show? A recent meta-analysis found that, on average, people with osteoporosis had lower blood levels of irisin, and fracture groups also tended to have lower levels. That is an interesting signal. It suggests irisin may be linked to bone health. However, it does not prove that raising irisin will prevent fractures. Lower irisin could also be a marker of lower muscle mass, frailty, inactivity, chronic disease, or inflammation. Now, about cold exposure. Some small human physiology studies suggest that shivering and cold stress can increase circulating irisin. But there is no standardized guideline-supported cold protocol proven to increase bone density or reduce fractures in older adults. And importantly, cold exposure is not risk-free, especially if you have heart disease, uncontrolled blood pressure, dizziness, a history of fainting, or rhythm problems. For many seniors, the fall risk in a bathroom alone is already a reason to be cautious. So if you choose to experiment with mild cold, it must be mild, optional, and safety first. Let me address medications honestly. Yes, osteoporosis medications can have side effects. Some rare complications are widely discussed online. But guidelines recommend pharmacologic therapy for people at high fracture risk because benefits outweigh risks. Also, the statement, "medications don't build bone," is incomplete. Some drugs mainly reduce bone breakdown, and that still reduces fracture risk. And some therapies, called anabolic therapies, actively stimulate bone formation for very high-risk patients. If you are on denosumab, do not delay or stop it without a clinician plan, because stopping suddenly can increase bone turnover and fracture risk. So what actually helps with the best evidence? Number 1, progressive strength training adapted to your level, not extreme, not painful, but consistent. Strength supports bone directly and reduces falls by improving stability. Number 2, balance and fall prevention. Strong bones matter, but preventing the fall matters even more. Number 3, adequate protein and calcium intake from food when possible, and vitamin D if you have deficiency, based on labs and clinician advice. And number 4, a personalized medical plan if your fracture risk is high. DXA results, prior fractures, medications, kidney function, and overall frailty. Here is a simple, safer example routine many older adults can discuss with your clinician or physiotherapist. This is not individualized medical advice. Think of it as a template. Before you start, use a stable chair against a wall, wear shoes, remove loose rugs, and keep a hand near a counter. Lower voice. Stop immediately if you feel chest pain, severe shortness of breath, faintness, new weakness, or sudden severe headache. Morning, 2 to 5 minutes. Sit to stand from a chair, slow and controlled, only in a pain-free range. If needed, use armrests or a higher chair. Then 30 to 60 seconds of easy marching in place while holding a counter. Midday, break long sitting with 2 to 3 minutes of movement each hour or two. A short walk, gentle heel raises holding support, or light band pulls. Afternoon, a walk at a comfortable pace. If safe, add brief, slightly faster intervals without breathlessness or dizziness. Evening, 5 to 10 minutes, wall push-ups, supported hip hinges, or resistance band rows. Controlled, good form, no rushing. If you still want to try cold exposure, keep it conservative. No ice baths, no breath-holding challenges, no slipping risk. Consider simply a slightly cooler room or a brief cool rinse of forearms, not a cold shock. Emphasis: and if you have cardiovascular disease, arrhythmia history, uncontrolled hypertension, Raynaud's, or frequent dizziness, skip cold exposure unless your clinician explicitly agrees. Here's the bottom line. Irisin is an interesting research signal linking muscle activity and bone biology. But the proven path to fewer fractures is still strength, balance, fall prevention, adequate nutrition, and when indicated, evidence-based medication under medical supervision. If you already have a fragility fracture, very low T-scores, or you're considering stopping a medication, please have that conversation with your clinician, not with a comment section. Take one safe step today. Stand up and sit down from a stable chair with support, pain-free, controlled. Then make tomorrow another safe step. That's how real bone health improves, without hype and without unnecessary risk.